Welcome to the Turd Nerds. We are the functional gastroenterology podcast discussing all things poop. Before we take the plunge into today's episode, let us tell you a bit about ourselves. I'm Dr. Rebecca Sand, a naturopathic physician and acupuncturist, and I specialize in all things gastroenterology, hormones, and fertility.
I'm Dr. Ami Kapadia, and I'm a medical doctor trained in family medicine and functional medicine with a special interest in gastrointestinal health, food and environmental allergies, and autoimmune disease.
And I'm Dr. Ilana Gurevich, a naturopathic physician and acupuncturist who is board certified in naturopathic gastroenterology. I specialize in inflammatory bowel disease, IBS, and other functional digestive disorders. Let's jump into today's episode.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
Welcome back, Turds. Today we are covering halitosis, and this is a problem that a lot of our patients have brought to us and confuses clinicians, I think, because what do you do about it? What plays into this?
I think we should also share that this is actually our second take.
Oh, yeah.
We recorded an amazing halitosis.
Was so good, guys.
We did it like 4 or 5 weeks ago, but then the recording just got lost to the ethers.
Technology.
The internet gods were against us.
I think it was pirated.
I can't remember how we started the episode, but it was really good.
It was so good. So, unfortunately, that's
You'll get
dead.
version 2.
But this is that was like a practice.
Right.
This one is going to be even better.
Right. And I definitely had a patient story, but now I can't remember who it was.
It'll come to you.
Yeah, we'll think of it. So I think what we're going to do today is sort of popcorn different halitosis things that come to mind, different things that we've seen in our clinical practice, things that could contribute to it, to have on your radar. Who wants to go first?
Why don't we try to maintain some organization, though everybody knows that's not our strong point.
Yeah.
Why don't we start with what are our...
Like a differential.
Differential.
Yeah.
What are we thinking when we're thinking halitosis?
Yep.
So definitely we're thinking gut imbalance, dysbiosis, especially things that are coming up, like the microbes that contribute to SIBO and GERD and fungus and all the things we've talked about, fermentation, etc.
I am often thinking the mouth and the teeth. Like,
Right.
I think that, I remember I went to school with somebody, I don't think this was my story, but I went to school with somebody and terrible breath, they were kind of known for having terrible breath. And it turned out they had terrible gingivitis.
Yeah.
They were running all of this infection in their mouth.
Yep.
And I will also say, I feel like I used to have halitosis that was bad. My mom used to tell me about it because your mom can generally be honest with you. Nobody else will.
Were you brushing?
Maybe your partner.
Yes, I was brushing. I don't know if your partner could.
Be that honest? I would.
I think
Yeah?
they
You have to
usually
live with that
would.
person.
Yeah. No, I think they would.
Oh, yeah.
I feel like if I had to be that honest, I'd have to do it in like a loving way.
I don't know.
Well, it's probably better to do it in a loving way.
My mom was not loving
You
about my
stink.
halitosis. What changed it for me, which is actually one of my best strategies, is actually the water pick. So when I think about halitosis, the first place I'm looking for gum disease, gingivitis, anything happening in the mouth.
This is why you stick with the water pick.
This is why I'm obsessed with my water
Yes,
pick.
okay.
Yeah. And so what I would say is so there's a difference between flossing and water pick. They're both important. They're both two separate things. Flossing is really good at like breaking down between the teeth. And the water pick is like power washing the gum lining. And I will also say, so I definitely think if you have an infection running in your mouth, it has so much impact on the rest of your health markers. Like that is one of the most common places for inflammation to hide is the mouth.
Yep.
And B, if you power wash these pockets, which is like, plaque, which is a biofilm, my favorite topic, will adhere between the teeth and the gum lining to trap bacteria in there. And if you power wash it with the water pick, you can get rid of
gross.
it.
Did that resolve your issue? And your mom told you to do this? Wow.
My mom was going to this crazy dentist with these huge hands. I'm still traumatized by his hands.
And they told you to do it?
Yeah.
Because you had gingivitis as a kid?
As a kid. I mean, I had Crohn's
wow.
disease.
Yeah.
I had Crohn's disease, so.
It's a thing with IBDs, though. Do you think it's because of the mouth involvement?
No,
or?
I think it's because of the bacterial dysbiosis, which goes through the entire GI tract. And I had Crohn's, which is a disease from the mouth to the anus. Mine was mainly in the terminal ileum, but I think that I had dysbiosis everywhere.
I think we talked about this, the water pick. Mold. Tell me how you keep it from
thank
getting
you. That
moldy.
is such a good point. So, okay, what is a water pick? Also, I have no
We will
financial...
then continue the differential diagnosis.
But it's important because I'm giving you a treatment.
Sorry.
So basically, a water pick is this electronic device where you put water in a basket up top, and then it fuels through this wiring to the pick that pressure washes your teeth, right? If you don't, it is definitely possible. You're usually using warm water because cold water would be irritating to the mouth. You can, if water stays in there, it can definitely get moldy. And I've seen this happen. And so one of the things that I do is when I'm done water picking and I dump out the rest of the water, I make sure I keep the water pick running so all the water comes out of the piping. So that's one of the things that I do. Yep. And then I will hang the receptacle, the water receptacle, upside down to dry. And then between the water receptacle and the actual electrical unit, you have to wash that off because biofilm will definitely form there. So those are the things that I do to maintain my water pick.
This is so much work.
It's really not. Really, it's water pick is about a minute.
I'm a daily flosser, and I feel really proud of that.
Good job.
I know.
But I hear you. I think it's
it's worth it. If you have a problem with halitosis and that's your part of the reason, I think that would motivate people to do it.
And more work is going to see a dentist because you have a bunch of issues and have to pay for all that.
I will just also say, just a quick little aside, the other thing that happens with gum lining is gum retraction.
Yep.
And I have, at this point, maybe 100 patients that I've been able to reverse that with.
Wow, that's great.
With the water flosser?
With a water flosser and methylfolate and methylcobalamin in the water flosser.
That's amazing.
In a rinse?
So
as part of the
so basically I have them get a very, very high dose methylfolate, methyl B12, and I have them drop it into the water pick, not very much, but enough to get like about 5,000 micrograms. And then I'm basically giving them like the nutrient that they need to regrow new cells in the place where the cells are diseased.
Wow.
And I have patients getting those 6-month follow-ups for the deep cleanings or even 3-month follow-ups for the deep cleanings, reversing it with the water flosser.
That is amazing. You should come out with a product.
Yeah, you should.
Oh, wow. We just gave it away.
Yeah, we just gave it away. I knew it. I was so close.
Okay. In the differential also would be sinus issues. So we'll go into more depth.
Before we go to that gut stuff, reflux.
Right.
We want to let's work up and down. Let's start with the head, differential on the head.
Okay, we'll start
first
at
is the gums, next is the sinuses. So talk us through that.
Oh, just if you have someone with halitosis and they have any sinus issues, whether it's from allergies, chronic sinusitis,
postnasal drip of any variety.
Right. So allergies, especially this time of year, multiple people coming in wondering if they have a flare of their asthma or why my cough. They just people don't always know when they have allergies. So it's worth trying just very simple allergy treatments if they're having a lot of sinus issues. It can also, of course, be microbial imbalance. We do various compounded nasal sinus rinses. It could be an environmental exposure that's causing like chronic inflammation. It could be eating like whole dairy products or just dairy products in general or mucus forming foods.
The sinuses are like a great place to harbor infections.
Yeah.
And whenever you're dealing with a patient who has chronic sinusitis, it is really, really hard to fully get rid of a chronic sinusitis patient because the sinuses are moist and warm and soft.
They're little petri dishes.
And they have all these nooks and crannies and, neti pots don't really get in there. Sinus irrigation doesn't really get in there. So it's like that. I feel like chronic sinusitis and halitosis are like a marriage made in hell.
Unfortunately. Yep. Yeah, there you go. And I think, the other thing is to just not forget there could be a structural cause because I've gone around and around with people doing all of these things and then finally we figure out, we send them to ENT and it's actually like an anatomical issue that's causing the bugs to stay there and the inflammation to stay there. And I do think if you, instead of neti pot, I generally have people do more of the squeeze bottle or the electronic sinugator just because it does get in there better.
Yep.
And I think, when we're talking about what is water, like how much of the sinuses we can cover with some kind of irrigation, even with the sinugator, I think you're hitting like 30% of them.
Right.
Like you're still missing most of the sinuses.
Yeah, and there are some naturopathic treatments you all have taught me about, like draining infection from closed spaces and such. It's probably more homeopathic that I think you've used in the past.
Yeah.
Yeah, so fix the sinuses. Postnasal drip is a big one.
Acupuncture probably also helps with drainage.
For sure.
Yeah.
I was just in a conversation with one of my colleagues Because one of the things that I do you do too, is a nasal specific. Are you trained in nasal specific?
As your resident, I did.
Okay. And that was the end of that.
Yeah, well.
So nasal specifics basically is this old naturopathic technique where you insert a balloon and inflate in the three different conchas on each side. It's so
painful to watch, but like afterwards.
It's such a relief.
Yeah.
To reset what happens often with the sinuses is, those bones are really, really small and they can very easily get out of alignment because of trauma, because of, somebody hitting your head, playing ball sports, having a young baby that bonks your face, like anybody who's a mom has been through that, because of chronic infections or inflammation, those bones can move. And so there's this old naturopathic technique where you put a balloon in, they're awake, you put in a balloon and you inflate and then very quickly deflate the sinuses. There is now this new technique that ENTs are doing, and they're charging about $10,000 for it. I charge a couple $100 for nasal specific. But they're going in a little bit deeper and they're doing the same thing, but deeper and like this concha and that concha, and they're taking a camera in, and that's called, I think, balloon sinoplasty. I think that's what they're calling it. It's the latest thing.
And it's just like an adjustment.
It's just like an adjustment. You're sedated but not asleep. And it is adjusting everything. Definitely, structurally and anatomically, that's really important.
And if you are going after microbes, the other point is that often we'll do a biofilm treatment. So whether you do the oral prescription, which somehow does seem to get to these various locations, or we do the local compounded treatment with the biofilm agent in it. Usually you need that for sinus things. And of course, in conventional medicine, we do use antibiotics sometimes.
Yeah.
So
and antibiotics are very effective for acutes.
Right.
Chronic.
And it makes it more challenging.
And one of the things that I'm doing is I'm often taking swabs of the sinuses, and I'm finding more complicated infections, like somebody who is
polymicrobial.
Yeah, or Marcan's positive or MRSA positive.
How often are you seeing that with intestinal biofilms?
I don't know if I can tell you that. I'm not sure.
Yeah,
like I
was
feel like
hoping you had
I feel like
that.
if it's a sinus patient, I'm looking at their sinuses.
Yeah, I'm just like really chronic biofilms if I'm not getting traction, and then we find out, there is a sinus history. Maybe they didn't know about postnasal drip. They thought it was allergies. That probably the same swab finding similar things in it.
Yep.
And I'm just curious, how often that is.
Yeah, I mean, I'm with you. I think that's always a thought process with my chronic people.
Yeah, it seeds the gut. So next on our stop here, tonsil stones.
Tonsil stones.
Okay, so we covered sinuses, dental.
Now we're going down the tube.
Okay.
Yeah. So tonsil stones, you're thinking of this in folks who had a lot of strep as a kid, a lot of scarring in their tonsils for whatever recurrent infections, and now their tonsils have these nice little pockets.
Beautifully large crypts.
Yep. That take our food in just as we need to be eating. And then bacteria has a heyday with it and forms these white little disgusting little balls.
And people who have these, they are usually very aware of them.
You cough them up.
Yeah.
They're foul smelling.
The
thing is, like, when they're in the little ball, people say they don't really smell that bad, but when they rupture, when they like break, it's really bad.
It's just a pocket of infection.
It's just a ball of bacteria, but it's white for whatever reason I don't really understand that. So you can extract them. You can have a dentist, I believe, extract them. Something that I've had a lot of traction in with my patients are like saltwater gurgles. You have to be really diligent, and then also adding some berberine powder to it can help, just as like an antibiotic, but you have to be on it.
Like twice a day on it?
Yeah.
Yeah.
Because they grow. And some tonsils just have these caverns that for me is like the biggest thing I've seen cause it for people.
So do you refer them to ENT then? If it's
I have
just
them
resistant?
try this. Yeah. Dentists I've seen like are willing to do it, but it really depends on the person's gag reflex.
Yeah.
Because you're getting back there. I've had people purchase, you can get syringes that have like a little hook
nose
to irrigate. I feel like a water pick would be a little too intense.
Yeah, water picks.
The pressure's too much.
Yeah, I mean, you can definitely set the pressure, but yes, that is definitely a problem.
Yep.
And then I also have a bunch of patients who have tonsil stones who will get in there and pick.
Yep.
Like
with their hand?
with
some sort of
the long Q-tips.
A tongue depressor or the long Q-tips.
Long Q-tips and like pencils with pencil
erasers. If their
erasers.
gag reflex isn't too bad.
The thing is, the tonsils are highly vascular.
Yeah.
So they bleed.
Easily.
And if you're not careful, they can bleed and bleed and bleed, and you can be in trouble.
And those people have generally large tonsils.
Yeah.
They're
because they're full of bacteria.
Yeah, they're full of bacteria, and they got sclerotic as a child, and they never got smaller.
Yeah.
Does your neural therapy help with that?
I will
really
always often inject the tonsils just because it is a harbor of many infections.
Yeah,
And it's also, people like that, it's usually an interference field. So their immune system, or I should say their nervous system isn't really seeing them anymore because it's so inflamed.
It's an uncomfortable injection.
Yeah. It's very fast. It's very,
True,
very fast.
it's true.
When, one of the tricks that I learned, I have a story with my dad. I learned neural therapy because my dad was really into it. And at one point he was like, you need to inject your tonsils. And honestly, I don't know why, because I did not
You
have
did it to yourself?
No, he injected me. But I swear to God, he injected
Ilana
me.
injected me once.
I swear to God, he injected me with
I
an
asked
18
for
gauge
it.
needle.
You think?
I swear, the trauma of it. I don't know if he
I
says
think it
I
just
didn't.
feels like that.
I've had it done, like Ann Hill.
Oh,
who I
really?
teach
And it
with.
was fine?
It was totally fine.
So you're blaming your dad.
I mean, I'm not sure if it was the trauma because he's my dad. Like, don't inject your kids.
Right.
That's the lesson.
Good
Don't
rule
give
of
your
thumb.
mom a gyne exam. Don't inject your
My
kids.
dad was really good at drawing blood. He would just bring the stuff home when we had to get.
Wow.
Yeah.
That's service.
I will say that I have, I wanted to run a food intolerance test on my kids, and so I stuck them while they were sleeping.
And now they hate you.
No, they were sleeping.
Oh.
But then they found out that I took their blood when
That
they were
is
sleeping, and they were like,
borderline cruel,
they were
Ilana.
like, "Are you a vampire?"
Yeah. Oh
I was like, I didn't want
gosh.
to deal with you whining. It was such a fast stick.
Consent. Oh my goodness. Okay, yeah. So tonsil stones, like, definitely be thinking about it. What comes next? Reflux?
Yeah, let's go down to the
Stuff
stomach.
that comes back up?
Yeah.
Yeah. So bile reflux, I would
Oh, so
definitely
stinky.
really
Yep.
stinky. Obviously acid or probably alkaline too.
And then also, like, don't forget about food stagnation
Yep.
or lack of motility
Totally.
in the stomach or lack of stomach emptying.
Yeah, it's just fermenting.
The more things sit there, the more they
Gastroparesis.
ferment, putrefy, rancidify, like all the things that happen.
Yeah.
Yeah, I mean, it's definitely.
Yeah.
Right.
So all the herbs that move things down. Great idea for
Yes.
these folks. Especially if it's a like hot bad breath picture. Like that's some stomach chi.
Quite the picture you've painted for us.
You know,
Hot,
I'm
bad
here to
breath?
help. Just, I mean, it's a type. you
Yeah,
know?
yeah. It's like
a type.
especially stinky.
Yeah.
A subcategory of halitosis.
Well, I've had patients who even say it, like their mouth
Huh.
feels hot.
Interesting.
You know, and yeah.
And I would say definitely having active reflux or GERD is gonna make it worse. Like that
Yeah.
stuff should be going down and working down the tube, and it's coming back up for you to regurgitate and taste
Yep.
and smell.
Another nice picture.
Yeah. So for sure, I would say
All the
reflux.
normal GI.
Yep, and then
microbial.
we walk down to dysbiosis in the small intestine and large intestine, especially small intestine. If you have a bunch of distension and gas and bloating in the small intestine, and you regurgitate back up, that's going to cause some odors.
Yeah.
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 Gases really anywhere.
Yeah.
Not a great idea.
It's interesting. Sometimes I'll have people with like really significant constipation, and when I'm doing an abdominal exam, I can smell stool. Have you guys had this experience?
No, but
You've heard you mention
you've
this
told
before.
us several times, and maybe I block it out.
Have you never been? You do body work, Dr.
Yeah.
Sand. You're not smelling that?
I'll have to pay more attention. I have like a super smeller nose.
Yeah.
So maybe I've just chalked it up to different bodies.
Huh. Yeah, I
I'm
can
gonna
always smell a
unfortunately pay
constipated
attention.
people. And it's not like if they're sitting in the room next to me, I can't smell constipation
Yeah.
then.
Right.
But if I'm doing
If you're
an
working
abdominal
on
exam,
things, yeah.
and I'm the abdominal exam, I don't do it through clothes, I do it on
Yeah.
the skin.
Well, it's
I
good
can
to
usually
use
smell
all
it.
your senses when you're diagnosing. So
Yeah,
Yeah, totally.
I can always smell that. Other tools that I feel like we've used in the past. So, okay, that's a differential. Now, what do we do? I talked about my water pick solution,
Yep.
tonsil stones. We
Yep.
talked about the gurgles.
Yep.
we talked about sinus treatments.
Yep. I think a cool thing with this is a lot of our carminatives are kind of doing double duty. So they use them for breath freshening and all of that. They're mildly antimicrobial. They help move things down. They help with gas.
So, that would be like peppermint, fennel,
Yep.
cardamom,
Yep.
clove. What else?
Just
Yeah.
like the aromatic sorts of
Yeah.
bitters,
digestive
right?
herbs, and then probably any of our prokinetics.
The gentian
ginger.
and
Yeah.
Scutellaria
Gentian,
mix.
ginger. Ginger's another carminative.
Yeah, peppermint I like because it has that sort of like cooling, stops spasm, also freshens breath for anyone who needs
Yeah,
that.
I mean, there's also those oral specific probiotics. I don't have a ton of experience using them with people, but I figure, I would probably throw that at it too if we're doing all these other things
Yeah.
and we think it's an oral hygiene kind of thing.
My pediatric dentist, my kid's
Right,
pediatric
right.
dentist, loves oral microbiome probiotics.
Okay.
I am curious to see how this is going to play out with I'm like, at this point in time, we've like dove into FMT and we're like, oh my God, there is so much that we can do with the large bowel and the microbiome makeup of the large bowel. And so now we're starting to go into, okay, what can we do with the microbiome of the mouth and what can we do with the microbiome of the vagina? Like those are the new two cutting edge where everybody's looking. And I'm curious because the mouth, every time you have plaque in your teeth, that's a biofilm, right? And so and every time you eat sugar or processed grains or anything refined, that's a way to continue to build the biofilm of the mouth. Mm-hmm. And so I'm curious to see, I think it's going to be difficult. Yeah. I don't think that a probiotic is going to make the difference. In my very limited experience, I don't think it's going to be the end all and be all.
Right.
It hasn't yet for anything.
Right.
So lots of promise there. They have their utility. They're just not solving all these problems.
Right. I agree. But they're also similar to air conditioning.
I do see,
when you use them, they're very effective. Yeah.
I love that. On the note of oral probiotics, there are a lot of other things we can just give for the oral microflora and health and all of that. Zinc for any healing, if there's like any tissue damage.
Vitamin A.
Swishing zinc, yeah.
Okay, you know what's crazy is I just had a patient in this week who has aphthous ulcers of the mouth.
Yep.
And she will apply glycine to it. And she's like, that's the one thing that gets me out an ulcer of the mouth. I've never done that.
Yeah. I haven't either.
That's cool.
It was interesting.
B12 orally, like you said. And then herbal astringents, golden seal, clove, and sage you can use.
The trick, at least with clove, is it's pretty caustic.
Yeah.
Like, you would use it when the kids were little for teething. And now my 11-year-old is getting her 12-year molars coming in. Yeah. And so we're putting clove on there. And she was like, oh, it touched my tongue. Like, it's pretty caustic.
Yeah, it's intense.
Yeah.
What about oil pulling?
Oh.
That's another good idea. I think along with the water pick, it's probably a good idea, probably as part of the whole comprehensive program if you're going to throw everything at it.
Mm-hmm. So there's two ways when I think about oil pulling. I think about it in like the traditional Ayurvedic way where they would use sesame oil, and now in the modern way where we use coconut oil, right? I will say I did try this for a bit.
Yeah.
It is very labor intensive to swish for 5 minutes. Mm-hmm. Like you have to be a certain personality.
Also with oil. That's gross.
And it like doesn't taste like oil after the first 30 seconds, but then you have to keep going. And then the other problem with oil is you can't, like, how do you discard it? You can't put it down the sink, right? Yeah. You don't want to oil up your sink.
So what'd you do?
I would put it in the garbage can, but then by the end of the week, like it was very difficult.
It's a whole thing.
It's a whole thing. For aphthous ulcers, I would generally start with sesame oil because sesame is so high in like zinc and vitamin E, and
totally, it has all the things.
It has all the things for mucous membranes, but it's difficult to get compliance, and I understand why.
B propolis as a spray. Lots of good antimicrobial qualities there. Good as I think they make mouthwashes, mouth sprays.
Yep, nasal sprays.
Totally. All sorts of things there. Aloe, back on the topic of ulcers, that soothes and heals it, and it's cooling.
Yes.
So good for that. You said vitamin A.
Just for mucous membrane healing, like with the zinc,
Yep. Yeah.
Yeah, vitamin A, vitamin E, C, zinc, E.
Yep.
All the fat solubles, really.
Yep.
Why not? Add them in. Diet.
Yeah, I think that's key.
Yeah, you have to remove refined sugars,
Yeah.
It's not going to help you at all to be eating those.
No.
Coffee.
Coffee is known, though. Isn't that just like, I don't know what that is.
There's coffee breath, but then it can also worsen, depending on what's causing it for folks. I'm coffee's biggest fan in the world, so there's no way. Like,
me and
people
coffee,
are just gonna have to deal with that.
There's no love lost between me and coffee.
That's my first caffeinated drink of the day, just in a small quantity before my chai, and then the green tea comes later.
I'm like that. I like that.
And then I get the eye twitch muscle.
Yeah, I get the eye twitch muscle when I go.
And then I take magnesium. And then I fall asleep.
That's all of those things seem so simple.
Yeah.
None of it works that simply for me.
Acidic foods, spicy foods like that. If that bothers you,
like if it bothers the person,
if reflux or inflammation is contributing to this for you, like you've got to have that on your radar.
I mean, I think it's known that coffee gives like everyone bad breath. Right?
I think it just has a very strong odor, and it's like a bitter,
that we interpret as it does not smell good. But it usually resolves after brushing and such. It's not usually like, everyone's telling me my breath stinks.
Yeah.
No, it's a different odor. It's not like a halitosis odor.
Yeah.
Yep. Yeah, and maybe some foods, at least what I've learned for things like ulcers and mouth health in general are going to be cabbage, radish, cucumber, kind of like cooling, kohlrabi.
Those are good. Yeah.
Yeah,
They're
you know what else?
and cooling.
Fruit. I do think that eating fruits and vegetables as your staple can pull that odor away.
But not dried fruit.
No, that's candy.
Yeah, that's why.
And probably that touches on water. If you're dehydrated...
Yeah, you have to drink water.
Right. Absolutely.
If you're dehydrated, that is just, nothing's going to smell good.
Absolutely.
Nothing's going to smell good. And
including
this actually
urine.
reminds me...
That's true.
Mouth breathers.
Oh yes,
good point.
We should talk about
skipped that with
mouth breathers, whether it's like sleep apnea, chronic congestion. My sweet little one, when she had RSV recently, I was like, is this what she's going to smell? Like, do kids just
she was
smell
snoring?
like this?
Oh.
She was so congested. She was just mouth breathing, poor sweetheart. It went away. She smells lovely, like a little angel, but that was a thing. I was like, wow, that is just mouth breathing for days on end. Will definitely make you have bad breath.
So you can do mouth taping, use nasal sprays at night so you can breathe through your nose, work on
sleep study if you need that.
I'm a big fan of mouth taping. I do think it works, not across the board. Like if you have severe sleep apnea, I don't think it's going to work.
Right.
If you have anatomical deformities, like in the sinuses and the nose, I think it's not going to work.
Well, you just won't be able to do it.
Right.
Yeah.
But it does stop my husband from snoring.
That's worth a lot.
Yeah, it is. It really, really is.
That keeps marriages together right there.
Along with having someone help to clean.
Yes, that's the most important.
That also, I can attest, is really lovely.
Yeah.
Yeah.
That's anything else that we can think about for halitosis? I think we covered most everything.
It was a good survey. Lots of systems to have on your radar. There are a lot of things we can do to help these folks. Just kind of do a really thorough history, figuring out what is at play for it. And then herbs really shine here. Herbs and diet, I would say.
So let's just summarize the differential for everyone to keep in mind. So sinuses, mouth breathing, dental hygiene, tonsil stones, reflux, gut dysbiosis, hydration.
I think that is a good summary, yes.
Okay, so you could just listen to that part.
And then diet
also
plays a part, but that's a different odor.
Yeah, that's, of course, everyone needs to work on.
And hydration. Drink water, people.
Okay, great episode. Hopefully it sticks this time and we can actually launch it. Bye, guys.
Stay tuned.
Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the Turd Nerd word.